Today we are discuss about the fluoroquinolones. Prior to the fluoroquinolones, nalidixic acid, which is a simple quinolone derivative, was being commonly used to treat the urinary tract infection which are caused by the gram-negative aerobic microorganism. In 1980s, with the introduction of 6-fluoroquinolones such as ciprofloxacin, it was a breakthrough in a quinolones that changed the history of all quinolones. On the basis of the time of their introduction into the clinical practice rather than their antibacterial spectrum, they are classified into the fourth generation. First generation included a norfloxacin, ciprofloxacin, ofloxacin, etc. Second generation included levofloxacin, flarioxacin, and clinafloxacin. Likewise, a third generation include gatifloxacin, sparfloxacin. Fourth generation included a moxifloxacin, travoafloxacin, and aldroafloxacin. They are actually classified on the basis of their time of introduction, not on the clinical or antibacterial spectrum. Most important in a fluoroquinolones is the mechanism of action. To understand the mechanism of action, first fluoroquinolones inhibit the enzyme DNA gyrase. DNA gyrase in a gram-negative bacteria, same action that DNA gyrase done in a gram-negative bacteria, same action in a gram-positive bacteria done by the topoisomerase 4. DNA gyrase contain two subunits, DNA gyrase subunit 1 and DNA gyrase subunit B. DNA gyrase subunit A has a function of nicking, or we can say that cutting of a DNA strand to prevent the overwinding or positive supercoiling. DNA gyrase subunit B has a function of resealing. Subunit A that cut the strand and subunit B the reseal that cutted strands of DNA for the replication or transcription process. Fluoroquinolones interfere with the separation of replicated chromosomal DNA into respected daughter cell at the time of the cell division. How it is done? It is a parent DNA. When at the process of replication or transcription, the two strands are separated and the another daughter DNA get attached, and this process leads to the next generation. But fluoroquinolones inhibit the enzyme DNA gyrase that doing a function of cutting and resealing of this parent DNA. What does it mean? It introduces a negative supercoiling. Two terms there as a negative supercoiling and positive supercoiling. Positive supercoiling means this is a positive supercoiling means a overwinding of this DNA, parent DNA overwinding, and a negative supercoiling means the natural binding of that parent DNA. So DNA gyrase introduce a negative supercoiling and cutting and resealing function. So fluoroquinolones inhibit the enzyme DNA gyrase in a bacteria, so it prevents the next generation of bacterium. Now the various adverse effects that occur due to the fluoroquinolones, that are QTC prolongation, matlab QT prolongation of QT interval, corrected QT intervals, and muscles ligament damage that is mainly occur in the cases of ciprofloxacin. Hepatotoxicity is in a rarely cases, and photosensitivity occur in a mostly cases, most generation of the fluoroquinolones. Fluoroquinolones has a various uses as a broad spectrum antibiotic. As we all know that it is a broad spectrum, so it has a various therapeutic uses like urinary tract infection, acute bacterial diarrhea, salmonella typhi, sexually transmitted disease, bone, soft tissue and wound infection, anthrax, respiratory infection, chronic prostatitis, cystic fibrosis. All these are the uses of fluoroquinolones. Thank you.